We're joined this evening by Dr. Ziv Haskal from UVA's Interventional Radiation Division for our house call to talk about a new clinical trial. It's about BPH. So let's explain what this is.
Benign prostatic hypertrophy. As we all get older, our prostates, which is a gland that sits underneath the bladder, slowly and gradually enlarges. And when we pass 50, as many as 60% of us, this gland grows and makes it hard to empty your bladder, hard to get a good stream. People are waking up 3 to 4 times a night. And after 80, as many as 90% of men have problem urinating. And that's why we spend over $4 billion a year in medications just to treat prostate enlargement.
Unfortunately, kind of standard as you get to 50 and above. So how do we go about treating it?
Well, if the medications don't work, and they do for most of us, then the next usual options are surgical procedures, a variety of them that urologists can do, from using lasers or cutting tools to increase the size of that tube that runs through the prostate. It doesn't necessarily shrink it its size, but it can create a better passage, but it can come with some complications and the risks of incontinence, being unable to hold your urine, or some erectile or sexual dysfunction as well. Naturally, things that as men we'd like to avoid.
Sure. Artery embolization, another thing to look at.
So I'm an interventional radiologist, which is a challenging thing to explain. We say that even our mothers don't know what we do for a living. And we use imaging in tiny little tubes to treat cancers and arteries and veins. And in this case, we're actually taking these little tubes to block the arteries to the prostate, to shrink it in place and avoid those complications. And this is now a clinical investigation that we're offering at UVA, one of the few or only places available in Virginia where we can do this exciting treatment for men.
And real quick, why would someone choose that, say, over conventional therapy?
Well, it seems like the complications and the risks we talked about are far less. You can avoid the incontinence, avoid the sexual dysfunction, get out of hospital the next day, and perhaps have equal or better results.
Sounds like a list of really good reasons. Dr. Ziv Haskal, appreciate your time tonight.